So we'll start with participant number 1, Vivek Verma, who's a HR business leader at a leading tech firm based in Kolkata. So let me just get him on the call. Give me one moment, please.
Hey Vivek.
Hi. How are you doing?
Hey, doing good. How are you?
Okay, I'm doing fine. You're able to hear me properly then. Audio was a problem in our last debate, but thankfully this looks better. So so what do you think, Vivek? I think we've talked about medical negligence. Are we ignorant as a population? And do you think that is leading to the state of violent attacks on doctors across the country? What's your take?
So, first of all, we need to understand whether is it only we as a population or is it a prevalent practice that has engulfed the entire world. What I know from my studies on this topic is that, China is one of the worst affected. There are violences in US, there are violences in UK as well. So, not only India, this is something which has, took up medical profession by surprise across the world. That's number one. Secondly, we need to understand the reason. I mean, is it only the ignorance or is it a media created ignorance? Because we as citizens, we don't know much about medical profession, right? And I'm sure I compare it with the masses, right? And what I think is that if, say for a dengue, right, if media is there and attributing to a cause of death, to a particular medicine not prescribed at the right time, then I as a citizen would probably believe it. Now why do I believe it? Is it the distrust in doctor or is it the distrust in the health practices that is prevalent across India?
Okay.
So I will also attribute it, to the government, the way we have dealt with health industry or health sector over a period of time. Now, I'm sure, Swapnil, by your studies, you would be aware that within a 5-year span of time, we would be moving to a virtual healthcare. I mean, that's how the world is moving, right? Companies like Dr. Insta, they are trying to transform the entire industry, and you'll see more and more doctors using the video platforms to prescribe medicines. It's going to be a life-changing experience in 5 to 6 years time, right?
Sure.
But then I think government should do enough. Okay, so my 3 things, if I have to tell you, one is that the health sector as overall should improve in India. The faith in doctors should be created by media, and third is the medical as a profession, the hospitals as a profession should make procedures more transparent and should keep on educating, engaging and counseling with the patient party time and again to create that trust in the admission or in the procedure, in the practice that they are following. So that's my take. Thanks.
Okay. So basically so one, very clearly what you're saying is it's not just a practice. The attacks on doctors or the violence or this violent streak is not just restricted to India. You're saying it's across the world. Maybe it's driven by the social media frenzy, who knows. That's a fair point. The other thing is clearly I think one difference that I can make out, and you've also pointed to that, is in India medical industry is typically dominated by the private sector. I mean the public sector isn't there, and that's very different from how it is across the globe. So clearly the government has to do more. It has been lacking. Healthcare has been a problem, and it's not just we've seen healthcare insurance. The governments across, I mean the state governments were doing it earlier. Now the central government also has talked about health insurance, but health insurance is just taking care of the cost of the healthcare. We also need to look at the administration, the prescription, the treatment, and that's where the government has been lacking. So I clearly get your point. And the last thing what you also mentioned, I think you touched upon, is the communication. I mean, I believe that's what you're saying. I mean, the communication between the doctors and patients, and not just a specific case, but general.
Sorry to interrupt. Not only communication. I think it's about the overall engagement. Okay, communication is a part of engagement, right? Engage with them, keep in touch, let them aware, keep them updated on things that are happening. Keep them updated on the possible, repercussions or the possible treatments that can be given. So it's about the overall engagement from the hospital. Right now, if you go to a private hospital, probably a poor person will feel that nobody is taking care of them because because they're more interested in minting money, right, rather than taking care of patients. So I think it's about the overall engagement, and the profession or the sector overall has to become more people-centric, right, rather than cost-centric.
Sure. I think it's been advocated now that doctors need to be trained in the soft skills part as well. I mean, apart from this. So I think that's a good point. That's a good point. Thank you so much, Vivek. Thanks for your inputs, and glad to have you here and talk about it. I'll just get in speaker number 2. So if you could just disconnect yourself, please.
Okay.
Yeah. All right, great. So that was Vivek, talking about multiple things. You heard what his views are.